7 million children and 19 million adults have asthma, but what if that diagnosis is wrong?
CBS 2's Dr. Max Gomez points out a growing number of asthma patients actually have a condition that is easier to treat without drugs.
Beth Radcliffe is your typical active high school sophomore, but in 8th grade, she began struggling to breathe while playing her favorite sports.
It was really frightening because I didn't know what was happening and I didn't know what to do.
Beth was first diagnosed with sports-induced asthma, then full-blown asthma, and given an inhaler, but she still had trouble keeping up.
There was definitely a point when I didn't think I was going to be able to continue on with sports.
Turns out Beth didn't need an inhaler. She needed to see a speech pathologist.
We'll run through the rescue breathing technique.
Beth's asthma diagnosis was wrong. She really has PVFM, or paradoxical vocal fold motion.
What it is the inappropriate closure of the vocal folds while you're breathing in.
And that makes it hard to breathe. Asthma medications don't fix the problem. Instead, patients need to learn to control their throat muscles with a variety of breathing exercises. Doctors are seeing a sharp increase in cases, especially among teenagers.
We are identifying it in teenagers because it does directly impact their quality of life in school sports.
It's estimated that about 5% of sports-induced asthma cases are really PVFM, a much easier condition to treat.
People with PVFM that are using inhalers are actually unnecessarily putting those medications into their body.
After a few training sessions, Beth was ready to hit the court.
It is very relieving because you don't have to worry about bringing an inhaler, bringing a medicine, or taking a pill every day.
It's still important to rule out asthma first, which can be life-threatening. But if you or your child doesn't seem to get relief with asthma medications, it may be worth consulting a specialist because other conditions like PVFM or even acid reflux can often mimic asthma. Dr. Max Gomez, CBS 2 News.
And triggers for PVFM can include coughing, shouting, exercise, cold air, and irritants like smoke or pollen.